The waiting list for the treatment of several cancers stretches over 3 years at least in Gauteng. And this can be attributed to a number of factors, we're told, but one of the main is the closure of the Charlotte Maxeke Academic Hospital's oncology unit. The resignation of senior professionals due to the dysfunctional state of healthcare systems has also put a strain on cancer treatment. For a sense of what is actually taking place, at least from her perspective, let's begin Professor Benn. She's a specialist at Netcare Breast Care Center. And she joins us in our studios for her experience and perhaps some insights about what the solutions look like. Prof, it's so lovely having you with us. Thank you so much indeed for making the trip.
So much. So basically, my history is I've been with government for 34 years and at Helen Joseph for the last 17. So Charlotte runs the oncology aspect, and the head of oncology, Professor Demetria, is doing a sterling job. So I want to kudos out to her. I think our waiting times for chemo have come down. We have huge hassles around radiation waiting times due to machines and problems, and that is a concern in itself. If you separate out, I mean, for 17 years, since 2004, I've run massive unit at Helen Joseph where we see on average at least 150 women per week, at least 50 to 60 cancers per week. And we have a great radiology team, good admin. I actually love the hospital, great CEO at the moment. In any government environment, we have problems with deliverables, etc. For a long time, I brought deliverables onto the hospital premises, which really means I don't fit the shoe of government, and it's got me into a lot of, let's just say, deep water. Eventually leaving with me, trying to work up a more innovative way. So I've resigned with a hope to set up a nice NHI unit. So I think that what we have to realize, issues for me is that nobody asks to be diagnosed with a cancer. We see young girls, we see 22-year-olds, 26-year-olds, across the board. Breast cancer it's not ageist, racist or sexist, young men with breast cancer. And people have a right to, if they understand what's going on with their body, to access treatment, I believe, in a unit that's a specialist unit. So when people are turned away, so you've come from Midrand, you can't have treatment here, and you can't access a specialist unit, that doesn't sit well with me. At all. And I think we have to address that, and if we can't address it within the system, we have to find a system that can help people. It's great to hear that we're not completely lost to you. You know, there's great work that you want to continue doing outside of the healthcare facility, at least public-owned institutions at that. But I mean, you know, something ought to be said about what drives someone like you to that point. And I was hoping we'll have a discussion around what those challenges look like and where you reckon we are seriously dropping the ball, because we've spoken about the collapse of Gauteng Health for years now. So I think the issues that for me make it very difficult is lack of support. Lack of support, and it's not often from very senior people, it's just from that middle management section, which really is spending so much time pointing out what's wrong and what's wrong with clinicians. And if you spend your life in trouble for trying to find solutions, it's very draining. Because, for example, being a sole person to run massive units is, where's your more posting to help train up younger people to go? And I know a lot of the younger people we train at least 4 that I've had in the last year, have moved overseas. That's their choice. But we can run systems in place where we run fellowships, where we actually restrict people, we train them, and then say, give something back. So I'm very pro-government. I'm very pro-finding solutions. I get that sometimes government systems are a little bit like Gulliver. You know, there's so many little management issues that the giant can't stand. And I do think that we need to performance manage doctors, but I do think that we need to support what is working properly, and not take what's working properly and keep on battering it so that you can't do it. We have to find solutions outside of local government. We can't expect, if there's a problem with drains or a problem with suture material, for us just to put our hands up and say, well, terribly sorry, we're not going to service the patients, because it's not fair for that patient who's caught 3 taxis in their chemo window, who needs care. So as a clinician, I can't look at you and say, well, I'm terribly sorry, we just can't operate today. That's not right. I need to find a solution to make sure I'm looking after you. And we want support to find those solutions. It's such an amazing country. I'm always amazed when I listen to crises and how people rush in to help. So there are people who would be willing to help that may not be restricted within a local government environment. And we need to call out to those people, accept their help, be it foundations, be it private institutions, and make sure that we're doing what we're doing, which is looking after people who haven't asked to have cancer.
Absolutely. What you're mentioning is so important because often we'll hear that a lot of what's going right is where clinicians' hearts are at least in these institutions.
Absolutely.
And we've heard of instances where clinicians will go beyond the call of duty, and I mean that quite literally, spending their own money.
I do that regularly,
Tell us about that and the impact that it might have on your ability to keep going.
So I think we can keep going as long as it's not about recognition and it's not about being given a tap on the back. It's about not getting into trouble for doing that. It's about saying
so you get into trouble for instance, using your own money to help patients?
Totally.
Wow.
So the issue for us is about, and you've seen, you can't really say anything when you're within the situation. So, you know, you sign an agreement, you can't say anything when you work in a government environment. We've seen what happens to doctors who've said things when they work in. So I think we have to look at innovative ways of creating better care facilities. And for me, there's a lot wrong in private and government. So, for example, people on low-end schemes often have massive co-payments, and that's not right either. When you catch 2 taxis in to see someone in private, you don't want to have co-payments on your hospital bills, etc. So I'm looking at a way where we can group everything together and make sure we have good multidisciplinary care, because there are very few people who have expertise, and it's our responsibility to train and ensure that that expertise is promoted and further achieved in our country. So for me, I just want an opportunity to look at particularly people who don't have access to care and work out a better way that they can get a more holistic service. Such, for example, you have to be able to, 7 out of 10 ladies can have breast-saving operations with a breast cancer. So if you're not training up people and giving that opportunity for people to have that breast-saving operation, you shouldn't just be told, well, you have to have your breast off because there's no service available. That is awful.
Absolutely. Let's speak a bit more about the plight of patients, because we're told in some instances they have to wait years before they can get some kind of treatment. Not ideal, and that's putting it lightly when it comes to cancer, because we do know that time is such a crucial aspect in order to save lives. I mean, for instance, we've heard of stories where people who finally make it to the top of the list are rung for multiple days until it dawns on the person that they've died.
It's terrible. So I've always run open access units, so that is important for me and part of the reason why I want to come up with a different system. So I've published on this concept. In trauma, we have a trauma triage, red, yellow, green. So if you've got, say, for example, a lump, you need to be able to access that care fairly quickly. So you don't want to go to a local clinic and then be turned around and being told that, I'm terribly sorry, you have to come back and there's not a service, because you've taken hard-earned money, if you're fortunate enough to have a job, to catch 2 taxis to go there, and then you only come back 2 months later. So people often say to me, why do people in this country arrive with late breast cancers and big cancers? My worst word is the concept of ignorant. People are not ignorant. You know if you've got a headache, a lump in your breast, a stone in your shoe. So why are people not accessing? It's because we have a hostile medical environment for them to access. Our environment has to be promote, we welcome you, we're not turning you away, and we have a system that we can quickly triage what the problem is and how quickly we need to act on it. That's important. So that solves that problem of delays. Right.
Speaking about solutions, we had the newly elected health MEC in our studios, Nomantu Nkomorale Hoko.
Yes.
And part of the questions we posed to her is how aware she might be about what's actually happening.
I think people are.
Yeah. I mean, are you open to meeting with someone like the MEC and trying to find those solutions?
Absolutely. It's, for example, we have a brilliant CEO at Helen Joseph who's just getting her feet. And I don't even think for her, she was aware of the extent of what was happening with the smaller units in the hospital. It's very hard because, like I said, it's a bit like Gulliver. It's a big system. So, and in any system, be it a school, be it a government system, you have a hierarchy of how you have to approach. So if you keep on being battered by your immediate seniors, you say, well, there's nothing further you can do, which is really what I did, rightly or wrongly so. But often people right at the top, it's harder to access them. So I think they're amazing people from a national health and a Gauteng health point of view. And there are solutions, but sometimes you have to step outside of the institution to find the solution.
Yeah.
Yeah.
Among the many problems we've heard about is, for instance, just how wasteful we are because of things like corruption and maladministration within Gauteng Health.
Yeah.
I'm not even quite sure what the question insofar as this is, but, you know, to what extent, for instance, do you reckon more could be done if we could solve some of those issues?
Absolutely. Absolutely. Maybe less people pointing out it's someone else's fault. So if you don't have something, you're not allowed to access it because it must be sorted by quality or it must be sorted by this department or that department. I think that the structure is so unwieldy that it's very hard to get down to the nitty-gritty of how to solve it. And I do think there's a lot to be said for people who are prepared to manage units successfully, that they should manage the units. So it always amazes me, something, for example, as bringing funding in. So I mentioned a little bit about the low medical scheme. So it would not be unreasonable. Oftentimes I would bring the patients into government, manage them, etc. That money goes into some nebulous pot somewhere. We don't touch it because it's on our government salary or ours, and that money could be utilized within the institution to solve their immediate problems. So I do think there's an opportunity to look at doing things differently. And sometimes when you put more heads together, and it's such a pity for me that we don't collaborate more with, say, for example, people in business who understand business, people in different aspects of healthcare who can bring to the table different ways to solve problems, because there are always ways to solve a problem. So it's part of pity for me that I've had to step out to try and find a solution. I think I have a solution, okay? I've had loads of support around that solution, and it's not a solution where I'm saying it has to be done not within a government environment. So I'm very, very keen also to utilize the systems I've got and set them up in different areas.
Right.
So when I spoke to people within National Health, there's not just breakdown in Gauteng. If you look at Limpopo, Eastern Cape, all over. So it's utilizing, and I always say I have blonde, simple systems that mean easy access, quick solutions to healthcare, and you can roll them out.
Absolutely.
So maybe there's an opportunity.
Well, I mean, if there's any silver lining is that you're still as adamant that solutions need to be found at the very least for the patients who need the help.
Absolutely.
And hopefully, one can only pray you receive all the support you need.
I have no doubt. I have no doubt.
Thank you so much indeed for speaking to us.
Absolutely. Take care now.
Really do appreciate your time. Professor Carol Ann Benn, a specialist at Netcare's Breast Care Center. Some of the specialists who are now lost to Gauteng Health, at least the department itself, government-run institutions, and hopefully we won't see a continuation of that trend, at least when you consider how many people still need desperate help in order to treat cancer.